All right, so let's get the results of our morning poll, shall we?
Mm-hmm. All right, are we doing YouTube this hour, Steve?
Yes.
All right, because I want to know if the
camera's on. So.
All right, I want to know if all right, so I'll put on some clothes. Let me put on my camera now.
TMI.
Right. So the results of our poll, we asked this morning, do you believe that there should be a ban on the importation of fireworks in Trinidad and Tobago? Quite a bit of people voted this morning. 23 of you said yes. One person, Miss Maloney, said no. It'll be interesting to find out why Miss Maloney said no. Because no, Maloney had it hard too. But them fireworks.
Everywhere.
You sure? I think it's 2 people said no, you know.
No, she called back to confirm. She said no.
Okay.
I only got, she is the only person now who I heard said no. I stand corrected. But what is that? She voted no. And then when Steve Khan called Miss Maloney on the as a saying yes, she called back to say she said no.
Yeah, it was Miss Ingrid that time.
Yeah. So it's one
Steve here in Guyana, so.
What is that?
Yeah, but it happens. It happens.
What?
Yeah.
The dysfunction started with his feet and then moving up. So now it reaches ears. So you can imagine everything in between there going already.
Oh, dear Lord. I'm the ideal person. I'm the ideal person for you, Steve.
All right, so that's the result of poll. Of course, stay. You can log on to power102fm.com or go to our mobile app, which you should have by now, and vote. And tomorrow morning at 6:45, we'll give you the final results. All right.
They're not banning any importation of any fireworks.
They're not. You give us a call right now, all right? We do have in 15 minutes. We'll call the minister, Mr. Armour. But you can call us right now. 222-8255.
Not banning none because then people have powerful friends. And they could set up in Marval, in Arima, in Shagona, in San Fernando, and you know, all over the place, selling fireworks. You can't fire, you can't sell if you can't import. The authorities know it's a nuisance. They know it's dangerous. It's not the first time it's caused fires. Animals that are stressed, animals die every year. People have a loud chorus of calls every year because of the distress it causes by its indiscriminate use. It's dangerous on many fronts. But guess what? Somebody making money.
Like I said, did a video by East Dry River, how these fellas using it at each other.
Yep.
And as Wendell said, now they're masking the gunfire with the fireworks on New Year's Eve, which makes it even more dangerous.
Yeah.
But that ain't a problem. And you see, when the country has reached the stage of 600 plus murders, and you wonder when the little thing, the so-called little thing slide, this is why we've gotten to where we are now, because we've always allowed the so-called little things to slide.
Yeah.
So it started to cause a problem decades ago. We did nothing about it. Until it caused like an experiment, and I'm not wishing this because somebody go jump on themselves and ball, I wish in this. Like what the ball, I wish we had 600 murders last year, which is utter nonsense. When you see other jurisdictions that buildings and warehouses blow up and people die, that store fireworks. Have you ever seen those?
Yes.
Until that happens, then the authorities will take action.
Yeah. I have to agree with you. I have to agree with you.
So, and you hear something unfortunate, like 5 die in the fireworks warehouse explosion. Then they go rush fast to Parliament and pass laws to ban the importation or regulate it more stringently. But until then, it's only fireworks.
Because
my dog has a padded soundproof room, so I don't worry about that.
And imagine people have to go through these lengths to protect the elderly and the animals.
And the elderly.
Yeah.
The impact on in particular the elderly, because it's so, this year was particularly bad. Like they couldn't wait for COVID to done.
Correct.
And I was kind of surprised at
quarter to 12 and ended just after 1.
Yeah, at the average time.
I have to admit, I was surprised because last year gave us hope that it would.
It wasn't bad last year.
Yeah.
But this year, like they save it up.
Yeah, boy.
Maybe they buy one, get one free.
True, eh?
But they didn't care this year. They went on, and then they went on Monday night, And then they went on, some people Tuesday night.
Yeah. Last night had some.
Last night too. Okay.
Yeah.
So they've been going.
Yeah. We have some calls coming.
And then Carnival Tuesday and Friday we'll get again.
Good morning, caller.
Good morning, gentlemen, again.
Morning, lady, again.
Morning, darling. How you going? Morning. Wait. Don't jump in. You ain't talk to me yet. I'm to you.
Some people now going to forget what I had to say.
No. I go reinvigorate your memory for you. And I know how to do that.
Look that, she can't catch herself.
Paul, I tried to say what I had to say, Paul, confusing me. Listen, you see the question.
No, you're confusing you. You have your total bay.
I say, Total Bay. I pass the stage at Total Bay.
I don't think so.
I'm too old for Total Bay.
I don't think so.
Listen, I only asked the question. How only asked the question, I answered it. But you know, there is a clause. I wanted to say only for authorities at occasions like independence and so.
Yeah, but that is not ordinary citizens buying it. The state could import it to do that. Under special license. You understand?
So well, that's what I'm saying. You should have put in a clause that for ordinary citizens.
You're writing law now. I like that.
I like the fireworks, but you have to go and look at it in a controlled environment.
You like different kind of fireworks.
At a specific, that too. At a specific time. But you see this, listen, that going on for the rest of the weekend. Last night it was around me again here, front and back. Well, I had to say east, west, north and south. And I saw, according to Wendell, plenty, is it lantern or flares or what?
Flares.
Yeah, flares. I watched them traveling at a distance. I said, but that will fall on people's houses. What is going on in this country? Well, I went to bed. I lie down early. I say, I take a 5-star, I'll get it back for the countdown. I'm searching the stations to see if they have any parang, any dance sessions, anything, nothing. So I look at the station from abroad, the foreign station. But their own was an hour after. But I get up late, and just about the time I think was midnight. Is that almost wake me up, When I hear the gun, and you're all right, It had a lot of gunshots through that, Fire can be so overpowering. I heard some things that didn't sound like fireworks to me. It was ridiculous. And the dogs, well, all this morning, one of mine still crying. Oh, God, I put them up, I secure them, and oh, God, the dogs bawling, senior citizens shaking. What is that? It's too much, man. It's too much, and the house is too close. People hardly have yard space, all they're getting on with this nonsense. And Paul is right. It's high places, people in high places could get away with this thing here by importing that story. I don't know if the government making plenty taxes also from that fireworks. But if it's so, they have to stop that, They have to get income from some other sources.
But you know what else they'll say? Oh, in 9 days, Trinidad, and then people can forget about that, man, in 9 days.
The other, just I want to say briefly about this new variant. Subvariant of the subvariants. And it's more deadly than the real beginning variant. So I think the government, I watching the carnival here, the way people just behave and jump on one another, and it's a whole hog up and jam and wine. What is going to happen now with the precautions? You're talking about airport.
Me ain't worried because the only person jumping on and jamming and whining with is you.
Yeah, so. But it's sounding to me like, from what I read, certain things, articles, is that it's not even lingering in your nasal passage, going direct down into your lungs. So what this test going to prove? And I'm asking the minister, he only will have him there. Please let business places reintroduce washing of hands and hand sanitizer.
I find so.
Any places.
Well, Massey never stopped. I have to admit, Massey has never stopped.
But they don't enforce it, Wendell.
Yeah.
They don't enforce it like they used to. They used to make sure you're doing it before. They don't enforce it anymore. The sinks are still that you can wash your hands if you want, but they don't enforce it.
Yeah, but to me, the responsible thing to do is to do it, use it, if it's there.
Some places I go, they don't have sinks also, the stores, and you look around and say, where's the sanitizer? We stopped that long time. So, Minister, all you reintroduce it, please, and the wiping down of trolley handles and all that, because they say, as you touch somebody or a place, you can catch it. So it's more contagious. So to the Minister, reintroduce that washing of hands and sanitizing, please, and the wearing of the mask.
I'm not look. I hear you.
Thank you, Zena.
I'm not looking forward to that wearing of that mask again. No?
I still wear mine every time I go out. Good morning.
I see people driving alone in their cars.
6128255. Good morning.
Good morning, gentlemen.
Morning.
Mr. Wendell, is Mr. Embers what locate the 1.3 million for Tobago Carnival? They wanted their own carnival. They got their own carnival. What they doing with the next carnival? That was my question for this morning.
That's a good question. That's a good question too. And maybe we could pose it tomorrow or Friday. Should Tobago have a separate budget, again for another carnival? It's a good question. Thanks, Ms. Sampson.
I want to know who issued the check. If they have money and they don't know what to do with it, they can drop it in my mailbox, but Tobago cannot get money twice. Definitely cannot.
All right. It's a good question.
I don't know that Tobago got money for the October Carnival, to be fair. That was raised by private sector. And the assembly used as cultural allocation. I don't know that the government specifically funded the October Carnival.
That's something we got to find out. I don't know that Tobago would have been able to do that on their own.
I think that was largely private sector driven, that October Carnival.
Okay, well then we have to find out that. But I thought they had money swinging all over the place. I need a break.
But if you tell the country you want your own carnival in October, I don't understand why you want money for carnival in February and March.
Yeah.
But that is what I want to know myself.
Like you have another cultural trip to New York to plan.
It looks so.
All right, thank you. Good morning. Good morning.
Hi, good morning. Good morning. Good morning, gentlemen.
Morning.
That is a good question. I have had a question to ask for a long time, and this lady will bring it back up to me to remove it from my mind. Has the way the coronavirus spread changed? Because what we were told initially, that it was spread by droplets from your mouth and your sneezing and whatever. Also, it is spread by touch. But the primary way that it is spread is from droplets.
Yeah. The touch is the touch is associated with the droplets, Because if you hold the droplets. If you put your hand on the on anything where the droplets came, and then you touch somebody, that's how. So it really is about the droplets at the end of the day.
Right. But what we were told was the droplets goes directly from someone's coughing or sneezing, and you inhale it. That is how it's transmitted primarily.
Well, I guess that is one way. I don't see that being the only way.
So
because if you touch the droplet, if somebody sneeze on a let's say on a stool, a cat, and you touch it, and then you wipe your eye or rub your eye or something after, or you thing your nose. I have this habit of always thing in my nose. You understand? Because of my sinuses. You could get it that way.
All right. I guess my question is answered, because I never understood if what is the big thing about washing your hands now and you're not wearing a mask? And people insisted that you're washing your hands and they take your temperature and you're not wearing a mask. I didn't understand
that. The temperature thing to me is bogus. But we could talk to the minister about that. That to me is bogus. Because nobody recording it. Nobody could tell you that you're one over or under or whatever. That is bogus, but I don't have no problem with the sanitizing and washing your hand, simply because when you go into a grocery or a public place, you're touching a lot of other things. So you don't want that if you have the virus, that you're actually putting the virus onto other things that people are going to pick up. So I have no problem with that part.
But on the other hand, I don't support. Why should the minister have to come and mandate that we wash your hands?
Lincoln, where you living? Where you living?
I since that has been introduced, I have recognized how nasty your hand has been during the course of the thing. So every opportunity I see a thing now, I just still practice washing my hands.
Yeah.
A steering wheel is one of the nastiest things out too.
Yes. Since this has been this pandemic, and you're washing your hands, and somebody says have nice white clean plastic things, and you shame off when you put your hand under this thing, because I do construction, I do different things. So you never really practice really washing your hands during the course of the day. But when you wash your hands during the day, you're shame because the water black. So I still practice it. I don't need a minister of health to come and dictate to me, keep washing your hands. Anyway, I see a thing, I wash my hands.
Yeah, always do.
Because I personally believe we are still in a pandemic too.
Yeah, we are.
Going around and people going around with misconception that we're not in a pandemic anymore. You understand?
Yeah. We are still in a pandemic.
Thank you.
And people are still getting sick.
Yep.
And there are people who will get more sick than others.
I did one more call before I call my guests. Good morning. Good morning.
Hey, morning, Paul.
Morning, Mr. Patrick.
Hey, what's going on? You see this thing? It's real, the COVID is real. Our brother now who died weekend from COVID.
Oh Lord, sorry to hear about that.
He died, he was about 70 years. The wife said, we call him and he get the news and he collapsed. He was sick anyhow. That COVID thing real. So here's what's going on. People, all the better start to put back all the masks, and then all them business place, put back the thing outside it. Because people lax. People really let them all the guard right now, right? You understand? No, Tobago, Carnival. All they don't understand politics, boy. Carnival have to get the people money for Tobago Carnival because PNM going back to Tobago. You know they call an election in Tobago PNM. Go hold them back because they never stop supporting them. Like politics, like big politics playing all there. Yeah.
Good point, Mr. Patrick.
Right. Thanks, Mr. Patrick.
All right.
So Mr. Patrick is foreseeing a snap election in Tobago, and PNM winning all 15 seats. All right. We waited to get our guests online. Our guest will be Minister of Health, the Honorable Terrence Deyalsingh, and Dr. Brian Armour, who is the CEO of the Southwest Regional Health Authority. We're going to talk health issues this morning. Boy, do we have health issues. There are people who have health issues who don't know they have health issues. And one of them is bipolarism and things like that. I'd like to do a program on that. I'd like to get an expert in on people who suffer from bipolarism and split personalities and things, because we have several of those walking around. Several. Paul, you good?
Right here.
All right, okay. Can you get an expert on bipolarism and split personalities?
I've done some work on it myself, but I can't get an expert.
Yeah, let's do a program.
But they're two different things, eh?
Huh?
They're two completely different things.
Bipolarism and split personality?
Yes.
Okay.
Bipolarism
I would like to.
Personality is more akin to somebody who may be suffering from schizophrenia.
Mm-hmm.
Bipolarism is something completely different, where the people can go from the extremes of real lows to extreme highs in a short period of time.
Mm-hmm.
But there's an imbalance of this system.
Recording in progress.
All right. So
All right.
we have the minister online.
Yeah, I do have Minister Terrence Deyalsingh and Dr. Brian Armour online. He's CEO of the SWRHA. Good morning, gentlemen. Happy New Year.
Good morning, one and all. Happy New Year to each and every one of you and your listeners.
Wonderful.
Good morning.
Good morning, Dr. Armour.
Morning.
Welcome to the Power Breakfast Show. We have Paul Richards and Wendell Stephen, and Richard Ragoobarsingh will join us shortly.
Ready? Okay. Good morning, Mr. Deyalsingh, Minister Deyalsingh, and Dr. Armour. Happy New Year to you both.
Is this the first time you're speaking with Dr. Armour?
I don't think so. We spoke to him before.
Okay.
Yeah, we did.
So welcome to the Power Breakfast Show. Well, Minister, let's start off with the fact that COVID is still raging, and especially in China. How are we in Trinidad and Tobago preparing for it? And there are reports of a new variant. I don't know if you can confirm or deny it for us this morning.
Okay, so first of all, let's start with some facts. Last week over the Christmas vacation, I asked Dr. Carrington, who does the genomic sequencing for us, to advise me on what is circulating in Trinidad and to clear up the misconceptions about these new variants in inverted commas. The information I have from her in her written report is that Omicron, which was a new variant, which came on the scene in December of 2021, that variant of concern has spawned a series of children variants and then grandchildren variants, to put it in layman's terms. What is mistakenly happening is that people are referring to these children and grandchildren of Omicron as new variants, and they are not. They are subvariants. The XBB, which is what is circulating, is a combination of BA.2.10.1 and BA.2.7.5. So it's a combination of two children variants of Omicron. So let's clear that up. All these BA.7, BA.5, BA.2.10.1, XBB are not brand new variants, but are in fact descendants of Omicron. So I hope I could clear that up.
Okay.
In Trinidad and Tobago, BA.5 was detected since July 2022. And XBB has been detected since early December 2022. So it would have been circulating before that. Mm-hmm. What it means, therefore, is that these two variants, these two child variants of Omicron, look, I just made the same error, have been in Trinidad, and we have not seen an explosion of cases. What we have seen is a gradual increase in cases, and Dr. Armour can speak to that. Mm-hmm. The other part of your question, what are we doing? We took a decision in November last year that right after Christmas, this is before all this thing about China came up, we took a decision that we are going to ramp up our vaccination drive starting after the New Year's weekend in Trinidad and Tobago. What we were concerned about is not really China, because China wasn't on the map then. What we were concerned about is people coming down for Carnival from the North American countries and from Europe, bringing in influenza, bringing in COVID, because their health systems are now challenged with this triple pandemic of COVID, influenza, and something called RSV, respiratory syncytial virus. That is the rationale for us now asking people to get vaccinated, because Carnival is going to bring in thousands of persons into Trinidad and Tobago from the cold climates where these three viruses are circulating. So I hope I have answered your first question.
Yeah. As you raise the issue of vaccinations, I would have heard a comment from yesterday from Dr. David Bratt, who has basically rubbished the Sinopharm vaccination. because he says it's useless. His exact word is that it's useless because of the protection that it affords. How do you respond to that?
Okay, so I can only respond to nonsense with science. We engaged in a seroprevalence study last year done by the University of the West Indies by Dr. Carla Maria Alexander, independent of the Ministry of Health. We tested 949 samples at random. So I'm saying that up front. It's a random testing, whether you are vaccinated, unvaccinated, brand of vaccine, which is a pretty good sample size, 949. Of the 949 samples, 50 of them were non-reactive, meaning that those 50 samples did not show signs of antibodies. So 5.27% of the 949 were unreactive. However, 899 out of 949, or 94.73% of the samples, showed that those persons had immunity, whether it was due to vaccination, whether the vaccination was AstraZeneca, Johnson & Johnson, or Sinopharm, remembering that Sinopharm was our most popular vaccine, or immunity derived from what we call natural infection. You got COVID and then you develop immunity. So we are confident that these numbers tell us that between vaccination and naturally acquired immunity due to infection, that out of 949 samples, 899 people showed that they have antibodies to COVID. I could only respond to rubbish with science.
Well, I think he was, to be fair to him, though, he was a little more specific to its uselessness with children in particular, and I think elderly people. And I know that most of the people
again, you can't put rubbish in. We never use Sinopharm on children.
Okay.
We only use Pfizer pediatric on children. Right. So you know, it just baffles me why we say these things.
Minister Deyalsingh, in the study, did they go as far as disaggregating out of the 800 and out of the 900 people in the sample who took what vaccine, so they could disaggregate which was the more potent?
That is what they are doing now. These are the preliminary results which we got in early December, and which, Paul, I shared in the Senate when I had that ridiculous motion by David Naked. I read out the same report in the Senate. You may recall that, or you may not.
I remember when you came and did that.
Yeah.
The next question is, you spoke about if I can call them the subvariant.
Yeah. Hold on. I want to answer your question. Dr. Alexander is now doing that disaggregation. Okay?
Okay. All right. So we can expect that result soon. If I can call it a subvariant of Omicron that you described earlier on, are those in any way more contagious or virulent?
There seems to be evidence that they are more transmissible, but the evidence also shows that with Omicron in the early stages, they may not result in significantly more hospitalizations or significantly more deaths, especially amongst the vaccinated.
Okay, so you're reintroducing the vaccination program from Friday.
And I would like Dr. Armour to come in here now to tell you what he is noticing in his hospital about the ratio of unvaccinated to vaccinated people.
All right, Dr. Armour, good morning again. Go ahead, please.
Hi, morning. So for Southwest Regional Health Authority at San Fernando General Hospital, where we have the hybrid system, we are housing COVID patients on the ward. So we have noted on the specialized hybrid ward, which is sequestered off and everything for infection prevention and control. So we noted when we started in November, after the closure of Augustus Long, on average, we will have about 5 to 6 patients on a given day. Within the last month, and listen to the Honorable Minister in terms of noting the Omicron variants, we have noted an increase in the number of persons on the wards at this time. So on average now it's about 20 persons on the ward, more so over the December Christmas period. And this is why, from a public health standpoint, aspects of persons coming in for Christmas period, increased socialization and so forth, we still have to practice, even though we want to remind the country again of the simple 3 W's that works all the time. But in terms of what we are noticing an increase in the number of persons with COVID and on the wards. Now, those with COVID, they clearly, most of them are what we'll call incidental COVID, in terms of they don't have the actual COVID disease, but they definitely have evidence that have been recently infected with COVID. And of course, they come in for their other diseases that they principally are treated with. So therefore, what that shows, that is a hallmark as being described in the discussion, that, COVID is still with us and that we still have to practice the safety measures. In terms of percentage vaccinated and unvaccinated, it still shows that persons who are coming to a hospital, most of them are still unvaccinated or have an incomplete vaccination series. So certainly at a national level with the whole vaccination program, I want to remind the public, the concept of herd immunity. So therefore, you vaccinate, you have to protect yourself as well. But the vaccine really works best on a population when as many people as possible become vaccinated, so that you do not have that level of transmissibility in the general population. And we have noted that throughout the ages with even vaccine-preventable diseases. So our very mature childhood immunization programs for other diseases demonstrate that fact. If our entire population is vaccinated or the herd threshold level is vaccinated, then you simply interrupt the transmission. So yes, COVID is still with us globally, but the issue of vaccination, both on an individual and a population-based level, is that vaccines wane. If even you get COVID and you require immunity, it's temporary. So the entire population, it is best to get the entire population vaccinated so that you could interrupt transmission in the long term. So I just wanted to emphasize that point.
Okay, let me just bring in Dr. Ragoobarsingh. Good morning. Just to our colleagues.
Hi, good morning. Good morning, guys.
Morning, Richard. Morning, Richard.
Dr. Armour, one more question. How covered are people who have had 2 vaccines at this point? Because we are always understood that, or Minister Deyalsingh, that the efficacy of the vaccinations wane after time. So persons who may have had a complete regimen as advised by the ministry or WHO, how covered are those people at this time?
Brian?
Okay. Yes, okay. Yes, so the Ministry of Health policy has been clear. As the science grows, so does the evidence. So initially there were 2 vaccines, and then they have recommended boosters, first and second boosters. So all those global initiatives supported by the local science and our expert team at the ministry. So vaccines do wane over time. COVID is an evolving science. So right now, if you have had 2 vaccines, we have encouraged since as of late last year, last year and even in 2022, to get the boosters. And if you haven't gotten boosters are still effective. And as per the national alert, the vaccines that are in use right now can boost any prior vaccine regimen that you had. That's for the adult population. So the science shows that 2 vaccines for the population, it tends to wane, and evidence has been there for about the last 12 to 18 months. So therefore, the booster campaign is necessary to get the entire population boosted. So as the Honorable Minister said in another place, in terms of you can take your individual booster for you, but in doing so, you are also protecting. If you encourage, we used to say +1 or +2, if you encourage other persons to get vaccinated, you all are going to help in terms of reducing transmitting the virus to somebody who's truly vulnerable and who can be at increased risk of hospitalization. So trust that answers the question. So 2 vaccines.
I have one question. Are we still doing contact tracing to determine when and where these people would have, who these people would have come into contact with? Because you said that a few people are showing up with symptoms. Are we able to determine where they may have or who they may have come into contact with?
Well, I'm saying that persons who are showing up have COVID. They are not necessarily presenting with symptoms for COVID, but what COVID does, if even you don't carry the symptoms, it could make some of your chronic diseases worse. So therefore, some people develop mild flu-like symptoms plus your chronic disease, and we test. So the thing is, yes, from a public health point of view, contact tracing is still going on for those cases. as the minister said, and even the data national in my authority shows that it's still at a low level, it's manageable. So therefore, contact tracing with the current resources we have is still occurring. But the thing is, in terms of with contact tracing, the thing is with the reality of movement and socialization and the issue of mask wearing limited to healthcare facilities. That's why the Ministry of Health, we're also saying, even though we have allowed, or the government has allowed economic activity and allowed people to return to some semblance of a normal life, anytime you're in an environment that you believe you're at high risk of exposure for influenza, it is still advised, it's still encouraged to wear a mask in those situations. So contact tracing, yes, is going on, but still with the virus, still with us, it's still good to practice those 3 W's, particularly if based on the evidence and the health promotion and based on your own perception of risk, you believe you're in a high exposure environment.
Mm-hmm. But Dr. Armour, I know you have all of these variants that would have, with regard to COVID-19, and I know the mRNA vaccines have been updating as the vaccine mutates, if that's the correct word, into these variants. How effective is it in terms of the current rollout of the Ministry of Health? Because I know particularly the 2 vaccines available will be Johnson & Johnson and Sinopharm, and they are not mRNA vaccines. Is it that they will still offer protection against the variants? Or is it that we should be trying to get some of those mRNA vaccines, which are more maneuverable in terms of the science, to tailor their effectiveness against variants?
Well, if I may, well, the issues of vaccine procurement and so forth, that's really the level of the Ministry of Health. So I feel more comfortable if the Honorable Minister may want to comment first.
We are always in the marketplace for vaccines. Even when we had the Pfizer vaccine, which was an mRNA, we had to beg people to take it. We had to dump hundreds of thousands of doses of mRNA vaccines. So the appetite for vaccines by the public doesn't really encourage us to bring in new vaccines. We have Johnson & Johnson and we have Sinopharm, and I confirmed yesterday with the experts that these 2 vaccines can offer significant protection against COVID even at this stage of the game, whilst we still try to source other vaccines. It is the same message we gave from day one. Take the vaccine that is in front of you. Don't wait, because when you wait, you become infected and you can die, especially the elderly. And this vaccination relaunch, which we are starting with on Friday, is directly targeted to protecting our elderly. I made the point that a young person playing mass, going to FET, can be asymptomatic, as Dr. Armour is saying, and you will be well, but you will take that virus home to your immunocompromised parent and grandparent, and they are going to pay the price. So we are advising people, let us protect our elderly, let us protect our immunocompromised people, like our cancer patients, patients on dialysis. We had too many dialysis patients die. We had too many cancer patients die because they were unvaccinated. The COVID came home and met them. So we are appealing to people with this Carnival season, especially with visitors coming in, to please get vaccinated to protect our elderly and immunocompromised as far as humanly possible.
Has it been discussed at all at the level of the cabinet or of government about the possibility of it affecting the Carnival celebrations, Minister?
No, our country is open. If you look at 2 pieces of government correspondence, one, the public health regulations, which I signed off on, which came into effect on the 1st of January, you would see absolutely no restrictions there. The only restriction is the continuing of wearing masks in healthcare settings. And then the Honorable Prime Minister's New Year's message, which were clear indications that the country is open and we want to be open.
What about the presentation of negative test results on arrival?
From China.
So as I have just explained, the public health regulations which signals to the population what we are doing made no mention of those things. So absolutely nothing has changed.
All right.
We have to get it in tape so we could play it in the news, you know. Minister Deyalsingh said, and the clip starts.
Yeah,
Yes.
that's how it works.
But if you look at the public health regulations, it makes no mention of testing of anybody coming in from any country at all. All that we are insisting on is the wearing of masks in hospitals and healthcare settings.
Because I don't know if you're aware that some airlines have initiated those particular policies from people coming in from.
That's fine. Yeah, that's fine. Yeah.
Okay.
Yeah.
All right.
Minister, what vaccine will you start in terms of COVID-19 with the reintroduction on Friday and on the weekends?
Sinopharm and J&J. And I will be in Trin City Mall to help launch that at 11 o'clock on Friday.
And what is the advisory regarding persons who may have had vaccinations before or no vaccinations? Can you give us an update on that?
Yeah, sure. That's a very good question to ask. So if you have never been vaccinated, start the vaccination process, either with J&J or Sinopharm. If you have been vaccinated, and as Dr. Armour said, it's incomplete, finish it. If you had your first 2 doses and you haven't been boosted, start the booster program. If you had your first 2 doses and your first booster, but didn't take your second booster, take your second booster. So the lesson or the moral of the story is, if you have not been vaccinated, start it. If you started it and didn't finish it, finish it. And that will give us a lot of protection moving forward, so the country could remain open. Because
now, does it matter what vaccine you've taken before? I'm presuming people should work with the vaccination cards.
It doesn't. Yeah. So just work with the vaccination card, as Dr. Moore said earlier.
Should we work with the digital one or the paper one?
The paper one. We don't have the digital one. Nice, right?
Oh, that's a good question.
So, Minister, let me ask you, what about those that took
you have to drop in that.
What about those that, like myself, who took the AstraZeneca?
It doesn't matter. It doesn't matter. That's what I say. WHO changed its guidelines around, I think, the middle of last year, in that now all vaccines are interchangeable. It doesn't matter what you started with. You can take any vaccine now as a booster or whatever. So it's totally...
Well, you're making me feel like a prostitute. I had 2 AstraZeneca and a Pfizer. Now I had to do a J&J or Sinopharm.
Well, I had 2 AstraZeneca and 2 Pfizer. I wish I could have taken a 5th one.
Oh, gosh. Don't put any ideas in Paul's head. Anyway.
And for those that took to get the flu vaccine, do you have to wait a period?
Yeah, we advise you wait about 2 weeks before you take either one. All right, so just wait about 2 weeks. And we are also advising people now, influenza. Influenza is raging in the cold countries in north of the equator, whether it's North America or Europe. And that is one of the reasons why they are having these restrictions too, because they want to avoid the triple pandemic or the tri-pandemic. We are lucky because of geography. We in a tropical climate, we don't suffer as much as the colder climates with influenza. However, we do have influenza circulating, influenza A, influenza B. We have administered just over 26,000 doses of influenza vaccine since the start of this vaccination program. And at these sites, starting on Friday, we'll be offering both influenza vaccines and COVID vaccines. So it's a one-stop shop for these circulating viruses, and we urge the population to make use of it.
Yeah. This question is for Dr. Armour. Dr. Armour, is there a concern, or will there be a concern of bed space at all? I know that was a concern in the last time that we would have gone through this exercise. Is that a concern at all in southern hospitals?
No, there's not a concern at this time. There are contingencies in place, so we do have capacity still. And plus, under the Ministry of Health guidance, we also network with the other RHAs as well, principally North Central RHA. And a reminder that, several of our parallel healthcare facilities are closed, but they are not being decommissioned. So the architecture is still there, could be reactivated by ministry policy that as RHAs we would follow. So right now it is not a concern, but I'm sure the whole country would appreciate that we do not want to go back there. And I do want to make a plug from where I sit for the healthcare workers to remind that because of the parallel healthcare system, what we found in other countries, even first world countries, with the healthcare workers themselves succumbing to COVID, that did not happen in a large degree here. So vaccination overall is the prevention, not only to prevent the individual health from becoming compromised, but to preserve the healthcare system so that we do have a healthcare system to function if somebody comes in with other ailments and diseases. So I do want to make a plug for that. So yes, the bed space is not an issue now, but we need the partnership and cooperation from the population so that we could all live and work and seek healthcare when we need it. We need to preserve the healthcare system through this exercise as well.
Minister Deyalsingh, I know you referenced the regulations you signed off on earlier this year, but is there any testing going on? Random, kind of there was random testing before. Fortunately, we're seeing a lot more cruise ships coming to Trinidad and Tobago, and of course, we're expecting an influx of visitors for Carnival. Now, while no official testing is required for persons coming in, is the ministry / the state testing people randomly so we get a sense of if people are coming in with virus loads or not?
No, we are not testing at ports of entry. We never did that. You don't do testing at ports of entry for COVID. What Brian is picking up is what we call incidental COVID, where you are testing people coming in for a particular condition, and then you realize that they have COVID. Countries all around the world have relaxed their testing protocols at this point in time of the pandemic. There is random testing. There is testing at the hospitals. And that is why Dr. Armour and the other hospitals are picking up these incidental COVID cases.
Is any measure of the parallel healthcare system still in place?
Yes, as Dr. Armour just said, the basic architecture is there. So the main hospital of the parallel healthcare system, which is still up and running, is Hoover. We have decommissioned Point Fortin since May last year, decommissioned Armour since June. Augustus Long, I don't think we have anybody there. And what we have moved towards is a hybrid system where we sequester in the normal healthcare system COVID patients to be treated in a sequestered manner, making sure that the infection doesn't jump to the general hospital population.
Understood. And I want to ask an unrelated question, but I want to complete your opportunity to tell the public that you start on Friday at Trinity Mall the reintroduction of the COVID vaccination and continuation of the influenza vaccination. So if you could give us information there before I ask the next question, please.
So we start on Friday at malls throughout Trinidad and Tobago. It is posted up on our website. We had a full page ad in the Express yesterday. I haven't looked at the papers today, but I'm assuming it's there again. So we're in Trinity Mall, West Mall, Starlight, Long Circular. We're in DSM Plaza, Shoguanas, 2 places up in Eastern. And Brian, maybe you could tell them where you are in Southwest.
Yeah, in Southwest, we're in Gulf City Mall, and we also have C3 Center as part of the national
So we have targeted malls, because malls, you have easy parking. It's a nice ambience there, and it's a high traffic, high volume area. And people are not going to a health center. People have this fear of going to a health center. So it's a good environment to come out, do some shopping, do some relaxing, easy parking, and get vaccinated.
And if you have the flu, you should wait until the flu has subsided.
Yes, well, as a general rule of thumb, no one who presents with a fever or flu-like symptoms is vaccinated with any vaccine. Isn't that right, Brian?
That's correct, Minister, yeah.
Right, yeah.
All right.
I have a question unrelated to COVID, but related to the health sector. What the bonus that was promised to the health workers, has it all been paid thus far?
Well, let me just add to that, because that was my question. It has been paid, but my understanding, I've spoken to 2 nurses and 2 doctors and 3 nurses who've said that while they've received payment, it has been heavily taxed. Can you confirm this?
Well, I won't say it's heavily taxed. It has been taxed in accordance with the law, whatever the tax rate is. So I want to use the adjective heavily taxed. And to answer the question, to the best of my knowledge, I think we put out a press release just before Christmas. At that point in time, if I remember correctly, 95% of people received it. And I think the last remaining 5% were people at the actual Ministry of Health, not healthcare workers in the RHAs. So by now, everybody should have had it. Tobago did have an issue, but I'm hoping that has been resolved.
Well, that's beautiful.
Another unrelated question. Can you or Dr. Armour indicate if you have seen a presentation of particularly elderly persons coming to hospitals displaying symptoms after New Year's celebration from stress, from fireworks, etc.?
I don't know if Dr. Armour can speak to that.
We have been checking thus far. No, we have checked at this point 3 EDs. We have 5 emergency departments, so we have seen no evidence of that. So we should get the final report today, but no evidence thus far.
All right, thanks.
All right. I have a couple of questions from our listeners before we close off. One question for the Honorable Minister: are children taking Sinopharm for their booster shots?
So as indicated, Sinopharm was never approved by WHO for children, and we never gave Sinopharm to children in Trinidad and Tobago. We used Pfizer, which we got as a gift from the government and people of Spain. And the uptake of that Pfizer vaccine for the pediatric population was very, very disappointingly low.
All right. Another question. GB in Trinity is asking, I took the 3 AstraZeneca when I went to the health center. I was told I can't get the Sinopharm as a second booster.
Well, I have no evidence of that. If that is the case, that is incorrect. As we have said, the vaccines are now interchangeable, but now that you have raised it, we will make sure and resensitize our health centers that the vaccines are interchangeable.
All right. I have a final question from BCC, and this is something that Paul brought up yesterday. Can you ask the health minister about the young lady who has a medical degree and currently doing filing in an office so as to meet her scholarship requirements? Paul raised that question yesterday.
So
Paul, you
I will have,
exaggerate?
So the Minister of Health does not hire people. The Minister of Health will not be aware of what each of the 20,000 healthcare workers in the system are doing and what their job descriptions are.
Minister, Johnson & Johnson is still a 1 job, right?
It's still a 1 job, but you could also boost it off afterwards. Yeah.
Okay. All right.
All right. Any more questions, gentlemen?
No, I'm good.
Minister Deyalsingh. All right, gentlemen, I want to thank you so much for being on the Power Breakfast Show as usual, Minister. Thanks for always being accessible to us as usual.
Recording stopped.
And all the best to you all for 2023. And we'll chat soon.
Thank you.
And I don't know how he didn't win that top prize at the end of the year. You know? I don't know how Minister Deyalsingh didn't win that top prize, but say what? I'll give him a prize when I see it.
Okay, brother. Thank you.
He has no communication positions with Wendell. They could stop this.
All right, all the best.
Thank you very much.
All right, let's get into our news brief. Evie, is it?
This is your news bulletin from Power 102 Digital.